Just before we get into your modelling that you've announced today, I just want to get your thoughts on some comments made yesterday by the New South Wales Health Minister about potentially living with the virus. Let's play that for you.
I think at some stage, if the individuals that we need don't hear Dr. Chan's message and don't respond, then at some point we're going to move to a stage where we're going to have to accept that the virus has a life which will continue in the community. But we're trying damned hard at the moment to make sure that we can use every effort to suppress that virus.
So the Minister says at some point we're going to have to live with the virus, which is true, but it might just be a while. What's your thoughts on those comments?
Yeah, I listened to that carefully too. He did say at some point, so there's been a slight misrepresentation in the media. Certainly at some point is not next Friday.
It could mean next year.
But it's also not next Friday. So let's go through it. It's not next Friday because if New South Wales and Sydney just let the lockdown go next Friday and there was still 5 to 10 cases occurring in the community where they hadn't been in isolation or quarantine, it will be bad, really bad. It will just go really ugly. But he's right that at some point we will have to learn to live with this virus. When we've got the vaccination coverage well north of 50%. Is when that might happen. And that pivots to the modelling that we've just released today to the public and policymakers, where we've modelled about 240 scenarios with all the combinations of the vaccination coverage we might achieve, and importantly, what the risk of people coming into the country is when those borders open up and how much they carry the virus. And so if we get to something like about 70% vaccination coverage, preferably with kids, then we could probably handle half the pre-COVID international arrivals coming in without quarantine, as long as they're vaccinated, because their risk of bringing the virus is less, but not zero, if they're coming from countries with the infection rate of about what Vietnam is now. But we wouldn't be able to open up to countries that have an infection rate of what Mexico has now. So we're still going to need to tune things at the border depending on our own settings within country.
When you say 70%, are you talking first or first jab or fully jabbed?
Fully jabbed at that point. But, you know, if some of the people have just had their first dose of the Pfizer or a Moderna or a Novavax by then, you'd probably be kind of okay. So the way that I think we should talk about this, I really respect that Prime Minister Morrison got the discussion going last Friday, but it's not just the vaccination target that we should be thinking of. I think the way to think about this is everybody has the right to have the opportunity to be vaccinated before we open those borders. And I would argue children as well. And then once we've done that, once we've allowed everybody that opportunity, we then see what the vaccination coverage is and we tune our settings at the border to match that and how we keep functioning within the country.
When you say children, Tony, what is the age? Where do you start?
Well, 16 and up now. I would suggest, and there's a lot more water to go under the bridge, that we will offer vaccination to 5 to 16-year-olds. And why? 2 reasons. The first one is that for the children, sure, they won't get too sick on average if they get the virus, but they still have a chance of quite serious illness and long COVID. And they're better probably to take the risk on the vaccine, which is minuscule for kids. And so the children need that opportunity to take that protection themselves. The second reason that it matters is children are 20% of our population. If they're unvaccinated, the virus will just get into where kids hang out, it's called schools, spread in the schools, and then go back up to the families. So getting the children, or at least offering the children the chance to be vaccinated, is important for our resilience as a community, as well as the protection to the individual child.
Okay. Would you have an idea on which jab they should have? Which is safe enough for them? Do we have modelling on that?
Well, at this point in time, the Pfizers, the Modernas, they're looking pretty good. There is the one little concern. No, let's not go there. Not for the kids anyway. I'm happy for people who want to, who are 20 and over, to go and get AstraZeneca and they've got informed consent. Back to kids.
Yep, sure.
There is a small concern about something called myocarditis, which is we get information around the heart. It does appear, particularly for teenage boys, that there is a small risk, probably even smaller than the risk of AstraZeneca and clotting, of this condition. I'm yet to see better data coming out. I'm hoping it's just a transitory thing, but there is a small risk. There's often a small risk with medical treatment, and we need better information on that. and we can get that in the next couple of months and then plan for however we allow and offer vaccination to children once we've got the adults done.
Okay, Tony, let's back things up a little bit. So you spoke about 70% a little bit earlier. So, I mean, 90% is just unlikely, right? We're just not going to get that high for a variety of reasons. So what is... Just to clarify, what is your magic number?
I don't want to have a magic number. My message is
because we were talking this week, and you know, it's vaccination. There's a whole. We've still got to social distance. It's got to be a complete package, and that message was loud and clear. But is there a level that you'd like to see?
I would love to see 70% for the whole population and then 90% for the people, say, 60 and over. The Brits, UK, they've got over 90% vaccination of their 60-plus-year-olds, and given they're the most vulnerable, they get that personal protection.
Yeah.
My approach to this is more to say, let's really go for it, get as many people vaccinated as possible, offer everybody the opportunity, and then we'll see what the vaccination coverage is, and we tune our other settings at the border, how much we still keep using masks so that we're resilient with the package. The more we get vaccinated, the less we'll have to do on mask wearing and all that sort of stuff, but we can create a package around wherever we get to a vaccination coverage to make us resilient.
Okay, and when you're talking border modification and perhaps opening up to other bubbles in terms of travel, you mentioned Vietnam, possibly some other countries as well. Are you talking early 2022? When are you talking?
Yeah, once we've allowed everybody a chance to be vaccinated. So imagine, well, let's hope, all adults have the chance to be vaccinated this year, and then between January and February, maybe early March, children given that opportunity. And then at that point, the big pivot point when we open up more fulsomely, that's when we make that thing now.
And what about stopping these lockdowns locally, Tony? Sorry to interrupt.
Well, the more that we get vaccinated, the better. So Brad Hazard, before where we started this interview, if we had that vaccination coverage in Sydney up to 50% or more, then it would help enormously to dampen these outbreaks. And then once we get to 70% or so, the outbreaks will be much easier to contain. The modelling we're doing at the moment, and we've worked hard with people in the know here about doing the contact tracing. The contact tracing is really effective at low rates. So if you've got the vaccination coverage up and you open up and there are infections coming in because you can't control it all, the contact tracing should usually be enough to really dampen things down and mean you don't have to use lockdown. So that would be great.
Tony, I mean, I'm out of time, but just one more. When the Premier says, New South Wales Premier says, that's it, next Friday we're reducing restrictions again, what's the danger there?
That's nuts. Sorry to be blunt here. If they don't get those infections that are in the community and not in isolation, so those occurring out in the community down to zero, by the time that those restrictions are eased, it will be really messy. I think it's much better to set the target around that than a date, and we learnt that in Victoria badly last year. Yeah, okay. Professor Tony Blakely from the University of Melbourne. A really interesting conversation. Thanks for joining us as always this morning. We'll talk to you soon.